Good afternoon, everybody. My name is Pamela Borges. I'm a postdoc, and I'll be presenting this work, which is a study that performed a clinical, pathological, and therapeutic characterization of breast cancer patients that were diagnosed at the Agostinho NETO Hospital in Cape Verde from 2015 to 2021. This work was actually sponsored by the Carlos Gulbenkian Foundation via Evolve Ciência Fellow Program, and it was performed together with Dr. Lúcio Lara Santos from IPO Porto and Dr. Irondina Borges, Dr. Carla Barbosa, and Dr. Victor Costa from Agostinho Neto Hospital in Cape Verde. We decided to perform this study because there was actually a rising trend in breast cancer incidence and mortality in several sub-Saharan African countries. And actually, Cape Verde, over the year of 2020, breast cancer was actually the second most common cancer among female. And we thought that more information regarding breast cancer characteristics in Cape Verde are required in order to not only improve therapeutic decisions, but also improve patient life quality, as well as increase survival rate by reducing the mortality. So the purpose of this study is to evaluate clinical, pathological, and therapeutic profile and seek or access eventual patterns in breast cancer in Cape Verde. So this is actually a longitudinal and observational study that selected 171 patients diagnosed with breast cancer at oncology unit of Agostinho Neto Hospital from 2015 to 2021. And from this patient, we selected 100 patients that had available samples to perform immunohistochemistry analysis. And the goal was to access hormone receptors of estrogen, progesterone, and human epidermal growth factor receptor 2. And we also accessed for proliferative Ki67 marker. And with this information, the molecular characterization of the breast cancer was made according to ESMO recommendations. When it comes to the results, we observed that 98% of these patients were female, and the average age at time of diagnosis was 55 years old. And we interestingly observed that actually 67% of these patients was domestic worker or did cleaning works as occupational job. And also we observed that 70% of these patients were from Santiago Island, where the hospital is set, but 30% of these patients were from other islands that came seeking for healthcare. And the most common applied diagnosis method was the primary tumor histology, which represented 92% of the diagnosis method applied. 83% of the cancers diagnosed breast cancers were actually invasive ductal carcinoma. And at the time of diagnosis, most of them were in late stage. In fact, 34% were on stage 3 and 80% was on stage 4. And most of this cancer, actually 49%, were poorly differentiated. Regarding the immunohistochemistry results, we observed that there's no pattern, neither there was a dominant breast cancer type. Actually, 35% of the analyzed cancer was classified as luminal A, 26% luminal B, 25% were triple negative. And we also observed that the most common applied treatments were actually surgery or surgery combined with chemotherapy or chemotherapy and radiotherapy. We observed that 88.4% of the patients survived beyond 24 months. And as expected, the patients that were diagnosed with a late stage cancer survived less. In conclusion, we actually observed that 84% of the patients survived beyond the 24 months of diagnosis. The cancers normally were in late stage at time of diagnosis, and most of them were poorly differentiated. Most of the cancer were invasive ductal carcinoma. Most of the patients did domestic or cleaning works as occupational job. With that, I would like to thank you very much, everybody, for listening.